Hello and welcome. You're watching Prudent Media. I'm Heather. Frequent urination, disturbed sleep, a weak urine flow. For many men, these changes appear quietly. Most dismiss these as signs of aging. Maybe it is. But what if it isn't? When should you truly start to worry? And what solutions do modern medicine have to offer? To discuss all of this and more, I have with me in the studio Dr. Ritvij Patankar, a consultant urologist from RG Hospital's Porvorim. Now, Dr. Patankar is known for his expertise in minimally invasive urology, advanced kidney stone treatment, and laser prostate surgery. Let's go say hello. Hello, Dr. Patankar. Thank you so much for joining us here today.
Good evening and hello.
Doctor, let's start with the simple question, which is what is the prostate and what role does it play in the human body?
So, to put it simply, prostate is a small gland of the male reproductive system and it is situated at the opening of the urinary bladder. It is through this prostate gland that the male urethra or the tube that carries urine passes. And what we usually say is this gland undergoes small changes as the man ages. To put it simply, during the younger ages, this gland is of a smaller size, say approximately around 9 to 11 grams or so. This gland is very sensitive to, obviously, the male hormone, that is testosterone. And under the influence of this hormone, testosterone, and its variant, it shows small and slow, steady enlargement as the man ages. So what happens is, during the puberty, when this gland was somewhere around say 9 to 11 grams, it tends to increase to up to say 30 grams or so as the man reaches his middle ages.
Is it a natural age-related change or do we look at it as something that's abnormal?
No, this can be considered as an age-related change because under the influence of the hormone, this particular hyperplasia of the gland is happening. That is, the number of muscles that are involved in the body of the prostate, they tend to slowly increase, and that's how this gland increases. Problem occurs is not because this gland is increasing by itself, but the main problem or the symptoms occur is because how this enlarging gland is compressing the male urethra, which is the hollow tube that is passing through this gland.
Okay. So does this need treatment? Because many men assume that, only when something becomes severe, then you go see a doctor.
So, to understand whether the prostatomegaly requires treatment per se or not, we have to first understand how this enlarging prostate is going to present to you. So, normally what we say is, somewhere as the man reaches the age of 50, 50 plus, they may now start feeling changes in their urinary pattern.
Okay.
So, initially a man may try to wake up once or twice to go pass urine. This may be the first symptom probably.
Okay.
Some people may then start slowly getting symptoms of not able to pass the urine, completely. So they get a sense of incomplete voiding.
Okay.
Always associated with them will be this particular symptom that the flow or the, the force of the urinary stream is not good. And always associated with these initial symptoms will be a peculiar symptom of weak stream. That is, the force of the urinary stream tends to weaken. So, this is the perception that the patient starts getting. What happens is, because we will be more comfortable speaking with our friends, or we may have noted something in our family like our parents or our grandparents, people usually tend to pass it on age, that this is because of age that is happening. True that it is because of age, but these are not the symptoms that can simply be missed. If these symptoms are ignored, then it will give rise to further symptomatology of prostate or BPH.
Okay. So what you're trying to say is that no matter what, although it is a normal part of aging, these symptoms have to always be medically evaluated.
100%. So what is usually recommended is when a man reaches the age of 50, he should start visiting his urologist annually. So, what does a urologist do during this annual urology visits? So, there are 2 to 3 things that we usually evaluate the person with. So, as part of the clinical evaluation, the first thing that we will be asking our patients will be the history. In this history, we try to get an idea as to how the urinary stream of this particular patient is getting affected because of the enlarging prostate. Along with the history, we have the patient undergo digital rectal examination, that is the physical examination of the growing prostate gland, wherein the doctor will be examining this particular gland and noting certain peculiar features, that how much this gland has enlarged, what are the grades, grade 1, grade 2, grade 3, etc. What is the feel of this particular gland? Is it soft? Is it firm? Is it hard? If hard, what type of hardness? Whether there are some nodules that have been noted on this growing gland, because each and every point that is been noted signals to some or other different path that may be encountered during this enlargement of the prostate. So, history, digital rectal examination. Apart from that, then comes the role of investigations. The most common investigation that we ask the patient to undertake are sonography, that is a USG, wherein we measure how the urinary measurements are or parameters are, like how much urine his bladder is holding, and after passing urine, how much he is retaining. When he goes to pass urine, we may ask him to pass that particular urine not in the washroom, but rather in a uroflow, wherein the specific graphical representation of the urinary stream can be garnered. So, we tend to garner some information from it, like what is the flow rate, what is the graphical pictorial pattern of this particular UFR. And along with these two, the blood test that we usually order, or which majority of the people may be knowing as well, is what is called as a PSA blood test, which is prostate specific antigen blood test. These various examinations put together will help the urologist know what the patient is undergoing as part and parcel of this BPH or prostatic enlargement.
So, you said that basically when a man turns 50, you start routine examinations, whether you have symptoms or not?
Yes, ideally, even if a person is not having any symptoms, an annual urology visit is something that is recommended, so that we can catch something early on. Now, just because the prostatic enlarging doesn't mean that your urologist will straight up put you on some medication. Symptoms are evaluated, and if at all the symptoms are warranting a treatment, then the urologist will start some or other form of treatment.
And are there certain men who would be more likely to develop something like prostate enlargement? I mean, if you have, say, maybe lifestyle diseases like diabetes, or does family history play a role?
So, all men have prostate, and all prostates will enlarge.
That's a given.
Yes, but not all enlarging prostates will give you symptom. Family history has a role in how that particular prostate is enlarging, but it plays more so, what you can say, a significant role when it comes to certain type of prostatic disease like prostate cancer. Lifestyle is, rather than affecting whether you will get prostatic enlargement or you will not get prostatic enlargement, the role that the lifestyle plays is how your symptoms will be presented. For example, if you are having a sedentary lifestyle, you are more of a caffeine addict, you are having more so spicy foods, or you tend to have a little bit of habit to have alcohol, especially in the evenings and all, on a routine basis. So these are various habits which will make such a person to develop symptoms more, because then what happens, an enlarging prostate is making your bladder to undergo certain kind of changes as well, because earlier when the emptying was without an obstruction,
Yes.
Prostatic enlargement is making your bladder to empty against some obstruction.
Okay.
So this also has some defining changes in how the bladder anatomy is going to change as this particular person ages.
Okay.
So the lifestyle plays a role in this particular fashion.
What about medicines? Now, you said that, certain people, not everyone, certain people would be put on medicines. Now, is this a form of treatment or does it only control symptoms?
So medicines basically are given for symptoms to be controlled. Uh, we do not look at prostatic enlargement as something which you will be reversing, because it's part and parcel of your aging process.
Okay.
So when we are considering treatment of prostatic enlargement, what your doctor is trying to do is trying to control your symptoms so that you can get a better quality of life.
Okay.
The initial treatment in most of the cases will be medicines. So there are various classes of medicines that are available. The commoner names that the people may be knowing is like tamsulosin or sildosine, which are alpha adrenergic blockers. Apart from that, there are other group of medicines that are available. Example, finasteride or dutasteride, which help control the hormonal aspect of this prostatic enlargement. So, and with this, there are certain other groups like 5-PD1 inhibitors, which can be employed, So, nowadays, even anticholinergic medication are being employed to give certain relief by playing on the various mechanisms that are causing the bladder obstructions. So when we say the obstruction part, usually what happens is the smooth muscles that are present in prostate and in and around the bladder neck, the main target of the medical treatment is to relax these muscles and try to make the way more pliable for the urine to pass.
Okay.
This is the mainstay of treatment. The hormonal medications like dutasteride, finasteride, who try to bring down the effect of testosterone,
Okay.
they usually have an effect on slightly reducing the prostate size as well by depleting the hormone and its role on the enlarging prostate. But it takes a lot of time.
Okay.
And it has its own side effect because of the hormonal depletion. So such
True.
patients may have decreased libido, that is the sexual drive. Some patients may develop gynecomastia if at all they are exposed to this drug on a longer duration. So yes, medical therapy is our first line of treatment.
Okay.
They come with their own shortcomings, side effects as well. We have to balance it depending upon what the patient is having as his regular symptoms.
So if someone is on medication, one question is, are you on medication for the rest of your life? And two is, even if you are on medication, can your symptoms worsen? So what are the other forms of treatment that are available to us today?
True. So your question itself has two parts to it. To answer the first part, if you are on medication, whether you have been put on medication for life or no, and whether your symptoms can change on medication. Both are very prudent, because what happens is when a person starts his medical line of treatment, he starts feeling better. And unfortunately, most of the patients take it like, I am being cured of prostate, and they stop their treatment. The problem comes when the treatment is being stopped, because then the symptoms recur.
Okay.
So you have to understand, the medicines are going to control your symptoms. They are not making your prostate go back to what it used to be in your younger ages. Right? So you have to continue your treatment as directed by your doctor. If you are facing some side effects because of the medication, kindly visit your urologist. You can discuss your side effect profile with your urologist, and we can then try to see whether there are some other answers to your particular problems that you may be facing because of the medication. Can your symptoms worsen because while you are on medicine? Yes, that is also true. To give you an analogy, while you are on your anti-diabetic treatment, if you tend to eat sweets, what is going to happen?
True.
So the medicines are not going to magically control your blood sugars.
Yes.
Similarly, there are certain factors which will make your prostate to act weird even if you are on your medicines. So what are the various factors? Commonly what we see is, if at all, the variations of the temperatures, they tend to affect the symptom profile of this enlarging prostate quite often.
Okay.
So the change of the seasons.
All right.
In Goa in particular, monsoon is the season. Early winters are the season wherein you tend to get patients who suddenly go into retention of urine.
Okay.
So this is happening because otherwise, when your body was maintaining its balance, these particular events, they are throwing your body off balance and it is going into retention of urine. So we tend to see more patients presenting with prostate related symptoms, retention of urine during the change of seasons, particularly in and around Goa. Likewise, there are other few changes. For example, if a person has habit of drinking alcohol and binge drinking,
Okay.
because of diuresis effect of alcohol, there will be a lot of urine that may be formed in short duration
amount
of time.
Yes.
His symptoms will worsen, and likewise.
So when do we move from medicines to treatment, to surgical treatment, say?
So to consider, the surgical treatment, medical treatment, what we have to understand is, nowadays we usually tend to tailor-made the treatment as per the patient's profile.
Okay.
What he is having. Most patient will be started with a medicine as their first step, and then during the course of their progress, we will be then either continuing the medicine or shifting over to surgery.
Would everyone require surgery?
Surgery, there are two things that we have to understand. Between medical and surgical treatment, surgery still remains the gold standard of treatment. Reason being is, the physical obstruction that your prostate gland that was causing, it can be directly treated with the surgery. Surgery means a minimally invasive endoscopic surgery, wherein we directly go in and we remove the adenoma, that is the enlarging gland that was within the urinary tube, that is urethra, and clear the passage.
Okay.
Right? Whether everyone needs or no. So then there are two parameters. One parameter is an absolute parameter. Absolute parameter means yes, you will require surgery. A person who is undergoing retention of urine again and again, person who has undergone urinary retention and who is not been able to be freed from the catheter, those who are forming stones because of the prostatic enlargement and the urinary retention, those patients who may be having bleeding because of the enlarging prostate, those who may undergo multiple urinary tract infections, those who may have back pressure changes because of retaining urine and whose creatinine starting. So these are various patient profile. Straight up we may consider surgery as a mainstay for them.
Okay.
And then there are patients who relatively, like those who are not getting effective symptom, benefit from the medical line of treatment. So means you have kept them on drugs and yet they are not getting effective quality of life because of this particular medication. There is certain group of patients who may decide that they don't want medications. They want to straight up go ahead and do the surgery.
Because of the side effects.
Because of the side effects, or sometimes patients don't want pill burden.
Okay.
They don't want to have a pill every day because you have to have it for the rest of your life.
True.
So in that case, such patients can also opt for surgery.
Okay. So you said that some people prefer to go straight to surgery. Some people, even if they are on medicine, they are recommended that they go to surgery rather than suffer. What are the treatment options that are available today?
So as far as surgery for prostate is considered, we have come a very, very, very long way. Initially, we can say 2 generations back, when open surgery was the only option for prostatic enlargement. Now we have come to the era of endoscopic surgery and beyond, with minimally invasive surgical techniques that are available, or what we call as MIST.
Okay.
So what has remained over the years as a standard of care when it comes to surgery is cystoscopy with TURP or TURP, that used to be a standard of care. Nowadays been replaced by something called as HOLAP or holmium laser, enucleation of prostate. So this HOLAP is now becoming slowly a gold standard treatment of endoscopic resection of the prostate. So what essentially we do when we say endoscopic resection is, with a camera we go inside of the urinary tube. There we see the enlarged gland, and now when we say with HOLAP, what we do is we tend to separate this gland from its capsule and move the entire enlarged gland, that is called as adenoma, inside the urinary bladder, from where it is being broken into small pieces and the pieces are sucked out. What used to happen in the previous generation surgery, that is the TURP, is the initial steps used to remain same. However, we had to make small cutting chips of this particular prostate, and then these chips were sucked out. Okay. The major disadvantage with this particular cutting was, since we are cutting the prostate into small chips, it used to bleed. Because it would bleed, there used to be a limitation as to what size of gland I can effectively remove, because there used to be a time limit for this particular TURP surgery. If we used to cross the time limit, then the chances of something called as TUR syndrome, which used to occur because of absorption of the irrigation fluid. Irrigation fluid is the liquid which helps us get visibility while we are operating. So it is continuously flowing. So this fluid used to get absorbed during the TURP procedures by the body. And if we are prolonging the surgeries, or if the major channels of blood vessels, they are getting opened, absorption used to be higher, and patient would be getting TUR syndromes in this particular case. Plus, bleeding profile of the patient needed to be watched very carefully. The energy source that was used was an electrical current. So what type of electrical current are you using? Is your patient a patient who is having a pacemaker or no? So there used to be many limitations on TURP operation.
Which is, we don't have
these all limitations were taken care of in the modern surgery, that is called as HOLAP. So in HOLAP, what we use is a laser as a energy source. So this laser will be directly separating the prostate gland from its capsule, and then it is being sucked out. So bleeding is absolutely minimal in HOLAP. Size is not the limit when it comes to HOLAP. So we have means in Goa, in RG, the maximum gland size that we have operated is about 160 grams, which is quite a large size, for which earlier the patient would have been subjected to an open surgery. Worldwide, even 600 grams of prostates have been operated with laser. And HOLAP is one laser which now, over this past decade or so, has garnered so much data that its efficacy and everything has become nearly standardized, and it is becoming a standard of care. There are other lasers also that are upcoming, like thulium laser, which it's called as THULAP or THUPLAP, that is thulium fiber lasers, and also there are multiple variations of lasers that are also available. Apart from these laser surgeries, yes, there are certain upcoming treatment as well that is available. Example, you may have heard of Urolift, wherein the prostate gland is stapled to the capsule, or Resume, wherein a water vapor is been inserted in this particular prostate gland, and we expect this particular prostate to slowly shrink. There is something called as aquablation therapy, wherein the water is used as a source. So we are using various sources of energy, and we are trying to give the open passage. There are some stents that are upcoming and under research module in US and other European countries, which try to see whether those patients who are not surgically fit, can they be treated on an outpatient basis, in an OPD basis, with insertion of these particular stents, wherein a passage can be opened up in the urethra, and patient is being able to given a chance to void. So these are the various advanced technique. What is available in Goa, that becomes a major, point of discussion. TURP is available widely in Goa, and it is a standard of care that is very well, been practiced over the many years. At RG, we regularly do HOLAP.
Okay.
So, as far as my extent knowledge, we are the only establishment to have a 100-watt laser,
Okay.
which is the machine that is required to do HOLAP operation safely, because energy source is what is of importance when we are cutting this particular tissue.
Okay.
So that particular mobility is being given by this particular machine, which is available with us at RG Hospital. So yes, TURP is done here in Goa, and we are doing HOLAP as well at RG Hospital. So the laser services are also available for the patients in Goa.
So I think that while aging is normal, suffering is not, thanks to
True.
all of your minimally invasive techniques. HOLAP, which is available in Goa, recovery is much quicker, I would assume.
Yes, patients are discharged on the second day of the surgery. So that they are walking, talking. The comorbidity because of the surgery is very less. All the patient has to do is just come back for removal of the catheter. Removal of catheter, this time of removal of catheter is also very much lesser when it comes to HOLAP vis-a-vis TURP surgery. And the flow rate, the wider channel that we can give after the surgery, they are much better with HOLAP.
Okay. That's wonderful, I think, Doctor. Two last questions before we close up. One would be that people fear visiting a doctor because sometimes they confuse prostate enlargement with perhaps prostate cancer. Can you tell our viewers how are these two different and why it is important in both cases to see a doctor early?
So I'll rather keep it very short. Prostate cancer, prostate enlargement, as per age, both are two different things. While all prostates will be enlarging as part and parcel of the aging process, not every enlarging prostate will get a prostate cancer. Prostate cancer has its own etiology, and it's a different subject altogether to talk about. But what we have to understand is, when you are visiting your urologist and he is doing the annual prostate related examinations, he is keeping a watch on you whether or not this enlarging prostate may be harboring cancer or not. So that is done with the digital rectal examination that I talked about earlier, the PSA that we talked about earlier, and only by properly monitoring a patient through these particular parameters, yes, there is a chance that we can catch cancers early if at all they are developing.
So I think the most important takeaway would be, if you are over 50 and you have symptoms or
Yes.
no symptoms, please go visit your urologist as soon as
Sure.
possible.
True, you have summed it really well, because that is the essence, that yes, prostate is something which every man will face. The only thing that we have to decide is, aging, like you said, doesn't mean suffering. You have to visit your urologist annually if you are 50 and above. And yes, if the symptoms have started appearing, he will discuss with you what will be the best mode of treatment that you are required as per your symptoms.
Dr. Patankar, say a patient has already had a successful surgery, whether it was the traditional method or via lasers, your TURP, your HOLAP. Are there chances of recurrence? Would a patient need to go through your medicines and your surgery all over again?
Yes. What happens is, when we are doing an endoscopic surgery, the adenoma, the prostatic adenoma that was enlarged within this particular urethra is taken care of. But the prostate that is remaining outside, the gland as in toto or total gland, we are not removing the gland per se.
Okay.
So the prostatic gland that is left behind in the body, it will slowly over the years will enlarge little bit and tend to grow in or grow back. What type of surgery you are undertaking can determine how long a duration of symptom-free period you may be getting. TURPs are known to give a symptom-free period somewhere around as minimum as 3 years to as maximum as 8 years, 9
Okay.
years. HOLAP gives you slightly better. say a minimal period 5 to 6 years, maximum period 10 to 12 years. So this difference is because of the channel.
Okay.
So since what we have seen through research over many years is the HOLAP is, as it is giving you a wider channel, the recurrence is little bit less when it's come to HOLAP compared to TURP. But in nutshell, in any case, if we are undergoing an endoscopy surgery and you are having a very good life, a longer life, yes, chances are that in future you may require some sort of either medicine or a re-endoscopic surgery to treat if the symptoms recur.
What about lifestyle changes? Would they help? Like you stop drinking, you exercise, you eat well.
Lifestyle changes, we can say, remain the bedrock when it comes to management of symptoms that are because of your prostatic enlargement. If you are having a good diet, good fiber in your diet, if you are having good water, staying hydrated, if you are having basic exercise along with pelvic floor exercises like Kegel exercises, if you have habit of walking, after meals and all, yes, these are all good, healthy lifestyle changes. They will help control the symptoms better as well. What can make the symptoms worse is if you dehydrate yourself, if you get urinary tract infections, if you are having a habit of having bladder stimulants like caffeine in form of coffee, if you are having alcohol, over time, yes, that is going to have some negative bearing on the symptoms that are presented by prostate.
So if you're watching this and ignoring your symptoms, thinking that it's just age, remember, like doctor has also said, aging is normal. Your prostate will enlarge, but suffering is not a part of this. Help is available, treatment is available, and relief is definitely possible. Thank you, Dr. Patankar, so much for joining us here today and for giving us your insights on this very important topic.
Thank you. Thanks a lot for having me here and giving me an opportunity to share this particular knowledge with our viewers. Thank you.
And to our viewers, thank you for joining us. This is Heather saying bye for today. Take care of yourselves, take care of your loved ones, stay informed, stay healthy, and keep watching Prudent Media.